To East Texas Live here on KETK. Joining me now is Texas Sedation Dentistry to talk about root canals. So explain, you brought some really good imagery here, but explain root canals.
Well, root canals is when bacteria have gotten into your tooth, whether from a cavity or a fractured tooth, and it kind of takes over the inner chamber of your tooth. So you have an option of getting a root canal, and most of that is in trying to seal the tooth off from that bacteria and stopping any infection going into the jawbone. Sometimes in cases they don't work. There is a failure rate that the root canals can get reinfected and end up with an abscess, just like pictured here where you see this big shadow at the root tip there. It's called an abscess. It's where infection is taking over again. So the options are to either retreat the root canal, which you've already spent a lot of money on doing a root canal, and then you got to get a crown on a root canal. So you wonder what your options are. You can either retreat it, or you can come to us and we can discuss options for implants, where we can decide that you don't want that tooth anymore and we can put you to sleep, get it extracted, heal the bone up, and put an implant in instead of a root canal.
And so what are the major differences between an implant and a root canal?
Well, an implant is basically a fake tooth. So instead of having a tooth that can be reinfected again and again, we actually just put a post that we would replace the roots of the tooth in and put a new tooth on that won't have cavities.
Wow, and so in terms of the patient, kind of, is there a different feel whenever the patient has an implant as opposed to just a root canal done?
Nope, it's just replaced.
Don't even know?
Nope, don't even know.
Wow, and so what are some of the major things that people need to keep in mind whenever they're making that decision?
Well, most of the time it has to do with money, and if they're kind of fed up with this type of scenario and this infection going on. It is an infection that can travel the body. It's not just located in the jawbone. The bacteria that's found in those types of things can travel to the heart and other parts of the body. So it's a concern versus health-wise versus a tooth. And at Texas Sedation Dental, we actually have a 3D X-ray cone beam that we can evaluate all of your root canals. We can scan through the bone. There are many canals inside chambers of teeth, and so you want to make sure that the first root canal had been filled in all those inner chambers, and we can do that with the 3D X-ray. Sometimes they're really small and they get missed, and that's why there's a failure rate.
Okay.
So we can always help with evaluating those and seeing if we can clean it up and just put an implant.
Now, I know one of our anchors here not too long ago had to get a root canal done, and he was in so much pain, and it's getting it done is so important too.
Yes.
Because if you have if your teeth are hurting you, then you're just kind of out of commission for a while.
Yeah, it has to do with the nerve in the tooth, and then of course once the infection gets to the jawbone, it does create a big ache. But we put you to sleep. We do sedation dentistry. You don't have to worry about that pain. We'll get you through it.
You'll get us through it. All right. Well, thank you so much for coming on. I really appreciate it. Now, if people want to know information, where can they go?
TexasSedationDental.com, or give us a call, 903-758-5551.
All right. Thank you so much. I really